guys, welcome back to Learning RN. So last video we kind of just shortly outlined the nursing process. So I thought that we could start kind of diving into each of those items a little bit more in depth, and it makes sense to start with the nursing assessment. Now if you're watching this video, you're probably a fairly new nurse. So often you'll hear maybe instructors or other nurses say always assess first. And I'd like to just change your thinking on that a little bit to always be assessing. Every time that you see that patient, every time that you look into their chart, you're gathering data. And that's what assessment really is gathering data. So how do we get this data? There's three main ways. The first being a patient interview. In a patient interview, you ask them tons of questions and you really get to develop a good patient and nurse relationship. And through that relationship, you can learn about their health history, their family history. You can do a review of systems. That information can be learned from the patient's family. And remember that the data collected in the patient interview is usually considered subjective. The second way to gather information or data about your patient is to really dive into their chart or medical record. In that, you can find a lot of information, including maybe what labs they've had drawn, whether those were high or low, what diagnostic procedures they've had and the results of those, and maybe some medicine. The data that you gather from diving into their chart or their medical record and from the physical assessment is considered objective data. Now we need to remember that nursing is holistic and that we need to look beyond just their physical complaints. And as a new nurse, it may seem overwhelming, but in time it's easier to focus in on the information that's relevant to your patient and to their current condition. So remember, the nursing assessment is the first step in the nursing process, but we're going to always be assessing.